Hey gang, it must be Wednesday. Welcome to Wisdom Wednesday from here at Austin Dental Spa. Hi, I'm Mark Sweeney. If you've tuned in before, you already know sort of what the format is. We do a little scientific stuff. There's always interesting information out there in the medical and dental community, and I try to bring it to you when it's hot off the presses. Today is no exception. We're going to have some fun. We always have a theme every month. This month it is a December to remember, so that shouldn't be too hard to remember. And we tried every week to do something that's memorable and that will give you some things, some tips to live a healthier life and have an overall better life. So today's no exception. Before I get into that, also wanted to just say we're a week away from Christmas. We will do Wisdom Wednesday next Wednesday, and then we'll be taking a break for Christmas, but we'll be back the Wednesday right after Christmas. So you're not getting rid of me that easy. So today, last week, if you tuned in, we drew a connection between things that are going on in the mouth, particularly the types of bacteria, and one in particular that is a streptococcus, and we talked about, or actually last week we talked about the one that causes Alzheimer's. And today we're going to talk about a different connection between the mouth and the brain, namely brain abscesses. And they've done some really cool research just recently at several universities, and I'm bringing that to you. We're actually going to talk about two different ones that I found very interesting. One of them was University of Pennsylvania Dental School. The other one was somewhere over in Germany. But and that's the first one we're going to talk about. Brain abscesses are not a real common thing. In fact, they're fairly uncommon. But when they do happen, it means you've got an infection with pus, which means white blood cells have attacked it in your brain somewhere. Typically, those only happen if you've got a severe infection somewhere else in the body and it gets into the bloodstream and it goes everywhere, called the systemic connection, and it ends up in the brain and setting up shop there. Or if you get a head injury, a severe head injury, and it gets infected from the outside, it can, on rare occasions, work its way through the skull and into the brain. And so, as you can imagine, either one of those situations, a brain abscess has a fairly high mortality rate, and so it's not something that any of us want to experience. Usually it's accompanied by severe dizziness and headaches, loss of speech or vision, depending on what part of the brain it affects. But this recent research that came out from Germany, they found 87 patients, I think, that had been hospitalized with brain abscesses. And they didn't say whether it's just in Germany or around the country. It doesn't really matter. What I thought was interesting about this study is these dentists actually looked into the hospital reports, and what they found is that the hospitals had not really identified a cause of how that abscess ended up in the brain. They just put them on antibiotics or went in and surgically removed the infection and then cured them and dismissed them, or the patient died. But in these 87 cases, the patient lived. What these dental researchers did is dig a step further and find out what kind of bacteria caused that infection. And out of the 87, 50-something of them, almost 70% of the infections were caused by microbes that are found in the mouth in dental infections. And over Thanksgiving, I had 5 different people contact me with swollen faces just over the Thanksgiving weekend. A couple of them were already patients here that had an infected tooth that swelled up out to the side of their face. A couple of them were new patients to our practice, but contacted me because their faces were swollen. So a dental infection with a certain kind of streptococcus, that infection is in your system. Once it gets out into the cheek tissue, it gets picked up by the bloodstream, and it can end up in all kinds of different organs. So it's not something to fool around with, but that I thought was very important, that 70% of these patients, and it was relatively small sample, admittedly, 87 people, but this research had never been done before, and they found it potentially had been a dental infection. or at least it was the same bacteria that caused dental infections. They didn't take it another step further and find out if people with brain abscesses had what kind of condition their mouth was in and if they'd had problems with their teeth, because hospitals don't ask that kind of stuff typically in their intake history. They just identify that they've got a problem with the inside the cranial vault and they go in and fix it. So but interesting research. So there is a connection. And that takes me a segue into our second research article, which is the one from the University of Pennsylvania. This one I thought was very interesting. They took mice, because for a long time we've known that mice and humans have very similar immune systems. Draw your own conclusions from that. You'd have to ask the big guy upstairs about that one. But anyway, and I know a lot of people that I would call rats, dirty rats, some of them, but that's another topic completely that would take much longer than a Wisdom Wednesday to go into. But anyway, they took these rats. They have long since, way back 4 decades ago when I was in dental school, they already had learned how to give a rat periodontal disease, gum disease, where bone is being destroyed and the teeth are getting loose. They inject them with the microbes that cause periodontal disease. There are 30-something different microbes that can cause gum disease, some of them nastier than others. Well, with mice, they inject them with the nasty ones so that they get gum disease. So in this study, they took mice, they gave them periodontal disease, and then they had a control group that were regular mice that had good gums, and then they took bone marrow from them and transplanted it into rats that had, or mice that had their bone marrow destroyed. So they needed bone marrow transplants. That's where your white blood cells come from. It's where your red blood cells get produced, is in the bone marrow. So they actually took stem cells from the bone marrow, and in the rats that had gum disease, when they took the bone marrow samples that were injected into a new set of rats, those rats were then induced to get arthritis. These poor rats. I mean, they've taken it on the chin for the human race. But anyway, they introduced arthritis into the rats that had been bone marrow transplanted with the rats that had gum disease. I hope you're following this. Got severe arthritis, much more severe than the rats who got bone marrow from the rats that did not have gum disease. So they know that there's a connection there, that the rats that had gum disease, their white blood cells have been trained to respond to inflammation, which for the most part is a good thing. But in this particular situation, it ended up with a negative result. And we can extrapolate that to human beings, that it probably is the same thing that happens in humans. So the results of this study, these dentists that did this study, it was just published in the journal Cell, C-E-L-L. But it's interesting stuff, because they don't pay attention in the hospitals when somebody's getting a bone marrow transplant. I'm pretty certain, even to this day, they don't ask them to get a dental evaluation and if they have gum disease. But it's very possible that if the bone marrow donor has gum disease or some other inflammatory situation, that the recipient of the bone marrow transplant is very likely to be more susceptible to that than they would have been had they gotten bone marrow from somebody else. So we'll find out. I'll keep up with this research as it's ongoing. Within a year, somebody else is going to not only duplicate that to make sure that it's duplicatable, but they're also going to take it a couple of steps further down the road. And our hope is, and the authors of this studies, their hope was that people that the hospitals that do these bone marrow transplants, which are getting to be fairly common procedures, will pay attention to the oral history on the people that are the donors. So anyway, I thought that was really interesting stuff, that cells down at the cellular level, at the stem cell level, they have a memory of things that they've responded to in the past, and it can be transferred from one rat to another. Therefore, we think we can extrapolate that it can be transmitted from one person to another. So interesting stuff if you're a dentist. Hope you found it interesting right here before Christmas. And of course, I always do a health tip. My health tip today this is a slow pitch. Careful with the hard candies at the holiday parties. I've already been to a couple of holiday parties, and there's always that one table or area on the counter that has all the good stuff that keeps me in business the rest of the year. All the hard candies and the fudge and the cookies and all that stuff. The hosts always put them right over there together. And so it makes it easy for me to identify who's over there, and then I kind of casually go over and slip a card into their pocket because they're going to need me somewhere down the road if they're the ones hanging out over there at the dessert tray. So go ahead and do what you're going to do at the holiday parties. Don't let me rain on your parade, but careful of the hard candies, because even the candy canes and the stuff like that, the people that say, oh, I just suck on it, well, they bite into them too. I've watched y'all. I've watched people that suck on them until they get nice and soft, and then they bite off on them and they chew on the chewy part, and it can pull dental work out. And the hard candy has a lot of sugar in it if it's the good kind, and so the bacteria in your mouth just go crazy, and you're going to increase the risk of gum disease and decay. So careful with that stuff. Back to the rats. Eat the cheese. Actually, I went into that last week with a health tip. If you're going to eat something sugary at a holiday party, go over there and get one of those chunks of the cheddar cheese. That's the best ones, that's kind of thick, and eat that right after eating the sweets. And it actually is the next best thing to having a toothbrush and brushing your teeth. That friction of the cheese sliding down your teeth can sometimes knock all that stuff off, and the pH of it kind of neutralizes the rise in pH, or the drop in pH, the rise in acidity from the sugar getting broken down by the bacteria around your teeth. So the better suggestion is don't eat the sugar, or limit the amount, and keep your teeth good and clean so that there aren't a whole lot of bacteria around to digest all that stuff. So that's my health tip for the week. I'll see you next week for one more Wisdom Wednesday before Christmas. And in the meantime, careful at those holiday parties. See you next week.